So everybody, I hope you had a good holidays, enjoyed your break. My name is Said Chaudhary. I am your instructor for this course, and I also teach anatomy and physiology, mostly part 1, part 2. I also teach neuroscience at WashU. So developmental biology is another course I teach. So mostly biology related courses I teach. I'm a full-time faculty here, so you can easily find me in this building. Most of the time I'm here. Before I start my lecture, I would go over a few important things, then I will start my lecture, okay? First, you are here to understand the biology of diseases, right? That means you are going to learn two things: how the human body works. That is the biology. And then how diseases occur in the human body. Okay? So that is pathology. Pathology is the branch of medical science that deals with the processes of diseases. How the diseases occur in the body. So first we will go over the function, how the body works. Okay? Then we will see how the diseases occur or take place. The two things basically you will learn. You know that if your car gives a trouble in the engine of your car, okay? Your car is giving trouble, you take it to the technician, right? Mechanic. To fix the car, that person must know how the car works. Make sense? That is the first thing you need to know. What are the parts of the engine, right? You need to know. And the function of each of those parts, you need to know, right? Otherwise, you won't be able to diagnose the problem, identify the problem, right? So to identify the problem, first thing what you need to know, right? How the engine works. What are the parts in that engine and each function of each part of it. And then you can diagnose the problem and treat it, fix it. Treatment is fixing, right? You fix the problem, right? So you need to know the normal function of the body to diagnose the problem or diseases and to fix it, to treat it, to cure it. Make sense? So, since this is not an advanced medicine course, we will go over the basic stuff. Okay? It's not very advanced, but try to understand the basic of it. So, first, you need to know how to use Blackboard. I believe most of you already know. So, if you open Blackboard, for some reason, this full screen it's not showing. You see in the left side, after you log in Blackboard, this is your course, Bio 151. And in the left side, you see a number of things. this is important, but the syllabus is posted. So you will find the syllabus here. So everybody make sure that you get a printout of it and read carefully. Okay? Let me quickly go over. So you see my contact information, my email, phone number, office room number, office hour. So feel free to come and talk to me. And this is your class hours, the book. Then this part is important. There are 5 exams, and each exam has 100 points, so total 500. And then 4 case study you will do, 25 points in each, so 100 points. Okay. If your average score is between 90 to 100, you will get A. If your average is 80 to 89, you will get B, and so on. Attendance is very important because you are here to understand the human body and the diseases, right? Human body is the most complicated, right, structure on the earth. So you are here, just remember this always, that you are here to learn the human body, right? So it is very important that you spend a good amount of time, okay, to go over the things that we talk in the classroom. So time is very important, that you spend every day, spend some time to study the materials. Here is the schedule, so you just have a look. But remember, this schedule is tentative schedule. That means it is nothing written on the stone. We can change the schedule if we need. Sometimes we'll go slow, sometimes we'll go fast. So we'll try to follow, but we may not. Okay. Do you have any questions? Anybody? No? Okay. So this is let's go back. Now here is the course content. This tab is also important. If you click there, you will find the lecture slides. Okay, so today, in our first day, we will go over a few things. First thing you need to know, the anatomy and physiology. That means human biology, how the body is structured. Anatomy is the structure of the body, and physiology is the function. So you need to know what is anatomy, what is physiology. As I have mentioned, if you don't know the structure, if you don't know how they work, then you won't be able to understand the diseases. So basic anatomy and physiology is the foundation, very basic to understand the diseases. Then we'll talk about homeostasis. What is homeostasis and how the homeostasis is maintained, and what happens if the homeostasis is lost in your body. So we'll talk about that. Then we'll talk about the pathology and pathophysiology, and then we'll talk about the what is a disease, and what are the causes of disease. Then we'll talk about the manifestations of disease, the terms or terminology that used to describe disease, diagnosis of disease, and as I have mentioned, causes and risk factors. So those are the things we'll go over. Okay. So first, what is anatomy? Anatomy is the study of the structure of the body. Okay. So anatomy is the study of the structure of the body. And physiology is the function, okay, of the body. Now, the structure includes, if I show you a heart, let me get a heart, that will help you to understand. So, this is a heart, right? How you know this is a heart? You look its shape, right? First thing, you look the shape is kind of conical shape, cone shaped, right? This is a pointed part called the apex. So by looking the shape, by looking at the blood vessels, right? Large blood vessels are attached to the heart, right? So you see a number of things, and you can tell that this is a heart, and that is the structure that includes the shape, size, and composition. Okay, so we see what kind of tissue is present in the wall of the heart. Okay, in the heart you have cardiac muscle, which is different than other muscles of the body, right? So we also look at the tissue. What kind of tissue is that? That is also anatomy, because tissue is the structure you study, right? What kind of structure in the wall? What kind of tissue is there? Make sense? So that is also anatomy. So anatomy is the study of the structure, and study structure includes the shape, size, and the composition. So physiology is the function. What kind of function? This is important. Normal function. Okay, normal function. Now, if I ask you, your heart, what's the function of the heart? Pumping the blood, right? Heart pumps the blood, sends the blood to the outside, right? So blood enters into the blood vessels, and blood vessels are present everywhere in the body, so blood circulates throughout the body. Is it clear? Okay. Now, you know that if heart fails to pump the blood, that is called heart failure, right? The heart cannot pump the blood. So, the function, when the normal function is lost, that is disease. Make sense? When the normal function, how many times your heart beats? Normal healthy person? Do you know?
80 to 180 per minute?
80 to?
80 to 180 between.
No, 180 is too high.
Well, if you're working out.
Right. When I say normal, That means normal resting condition,
Around
quiet sitting
80,
condition.
I see.
80 to 90. 80 to 90. What is
A
that?
little bit less than that.
70. 70?
70 to 80. We say 72, 70 to 80. Okay? Good. So, some books says 60 to 80. That's also acceptable.
Yeah.
But if you say 180, that's too high. Okay? In resting condition, exercise when you are doing or active condition, the heart rate goes up. Anyway, so let's say 60 to 80, normal range. That is normal, right? So that is physiology. If I see the heart rate is 60 to 80, I'll say the person is normal, right? Heartbeat is normal. Now, in normal resting, sitting, quiet condition, if you see that heart rate is 200, that is too high, right? That should not happen. So, that has crossed the limit. Make sense? So, that is a clinical condition, disease. In that case, we have that person needs treatment to cure that problem. So, you see that physiology is normal function, not abnormal function. But if the function becomes abnormal, that is disease. Okay? Or pathology. It's a pathological condition. Not physiological condition anymore. Is it clear? No more physiological condition. It's a pathological condition, and that is a disease. Okay. And pathophysiology is the study of the processes of disease. Okay, so how the disease occurs. The branch of science, medical science, that studies the processes of disease. That means how physiology becomes pathology. That is the pathophysiology. Okay. Okay. Now, homeostasis. What is homeostasis? Homeostasis is the process of maintaining internal body environment unchanged or constant. So, maintaining what? Internal body environment unchanged. So, let me give you a couple of examples. When you get scared, okay? When you get scared, then heart rate goes up, right? You know that. Palpitation, heart rate goes up. But after a while, heartbeat comes back to normal, right? You all know that. Sometimes heart rate goes up a lot, right? But after a while, it comes back to normal. Why that happens? Who brings the heart rate back to normal? Your control systems in the body. That means you have control systems in your body that tries to bring everything back to normal. Make sense? Try to bring everything back to normal. Otherwise, it is a problem, right? If you get scared, your heart rate goes up to 200 and it stays there for the rest of your life, right? That's dangerous. That's not good, right? So, if you know that a lot of things are changing, but are being also being adjusted, right? Brought back to, again, normal. You know, if you eat a lot, blood sugar goes up, right? After you have a good meal, blood sugar goes up, right? And your pancreas secretes what? Insulin to lower the blood sugar. Because if the blood sugar stays high, right, that is not good. You know. So, in this case, who is trying to bring the sugar back to normal? Insulin, right? Pancreas. That is an endocrine gland. So, two ways your homeostasis is maintained. Internal body environment is maintained by two ways. One is called nervous regulation or nervous control, and another is endocrine regulation or control. This one works through the nervous system, that means your brain, right? And this one works through what? Endocrine glands. The glands through hormones. So, endocrine regulation is done by hormones. And nervous regulation is controlled by the brain. Okay? Now, let's see your blood pressure. We know that when we measure the blood pressure, we measure two things, right? Systolic and diastolic. You all probably know that, right? Upper one and lower one, right? Systolic pressure and diastolic pressure. So, we know that in normal adult male, the systolic should not go up to 130 millimeter of mercury. This is the borderline, and this is lower. Systolic pressure is, we say 90 millimeter of mercury. So this is the range, normal, right? If his systolic pressure is between 90 to 130, we will consider that the pressure is normal. Is it clear? Now, it varies within that limit, we know that. Now, if for some reason the pressure tends to go up, your nervous system and endocrine system will work to keep it within this range. Make sense? Those two control systems will try to keep it down. Make sense? Within that range. So that is what happens all the time in healthy body. In healthy person's body, those two systems are always working to keep everything under control. Okay? And that is homeostasis. Is it clear? So, maintaining the internal environment within the range, physiological range. Make sense? Now, if the homeostasis fails, for example, if the control system fails here to bring it back down to normal, within normal range, then it will shoot up. Make sense? If the control system fails. And that will be considered as hypertension or high blood pressure. Make sense? So, if your control system fails, then it becomes a clinical condition, right? In this case, since your body system failed to bring it back to normal, you have to do what? You have to go to the doctor, right? That my blood pressure is high, so you have to do what? You have to take measures, medicine, right? To keep it within normal range. That's why we take the medicine or treatment? To keep it within normal. Okay. So the main thing here is homeostasis, and who are controlling the homeostasis? Those two systems of your body. Okay. And if homeostasis is not maintained, then it becomes abnormal, right? Condition, that is the disease or pathology. Okay. Now, homeostasis has two mechanisms. Positive and negative feedback. Okay, so positive feedback and negative feedback. Negative feedback works in most of the cases. In most of the cases, homeostasis works through negative feedback mechanisms. And negative feedback mechanisms can bring the function back to normal from high or move the function up from low to high. So both ways negative. Don't get confused. Sometimes you may think that only bringing down is negative. No, it can move up from below. So for example, let me give you another example. Body temperature. When body temperature increases, sweating occurs, right? Through the skin. And that water takes heat out from the body. Is it clear? Okay. So when the body temperature increases, sweating occurs, and that brings the body temperature down. So that is negative feedback, bringing down by releasing heat out from the body. Okay. But if hypothermia, have you heard the term hypothermia? If the body gets too cold, right? Hypo. Then shivering occurs. Contraction of the skeletal muscles, right? Shivering. And that contraction increases metabolism. And metabolism produces heat, right? So that heat is produced by the muscles and that increases the temperature. So tries to bring the temperature back to normal, right? So that is homeostasis. Make sense? Maintaining body temperature. Now both belong to negative feedback. So bringing back to normal from high back to normal or low bringing up back to normal. Okay? So both are negative feedback mechanisms. And most of the cases homeostasis or internal body environment is maintained by negative feedback mechanism. Positive feedback, let me quickly give you an example. Positive occurs only in few cases to enhance the activity which goes beyond the normal body function. For example, uterine contraction. Your uterus, during childbirth, uterus contracts, right? So first with contraction, then gradually the force of contraction increases. Enhancement, right, of force of contraction until the birth of the baby. Make sense? So you see, it continues to increase until the task is accomplished. Okay? So it is different, and that belongs to positive feedback mechanism. It enhances the function and it goes beyond the normal and stops once the task is accomplished. Now, sometimes positive feedback mechanism could be problematic. That can cause problem in the body. For example, when you get a cut if this is a blood vessel, okay, you get a cut. How the cut, that area is sealed by clot, right? You know that clot is formed to block that, right, opening. So what happens, the platelets, one type of blood cells accumulate here. So first small clot is formed, then more and more platelet accumulate, get attached to each other to seal the area, and that is called platelet flag. Flag is formed, okay, platelet flag to seal. So first small, then gradually more and more platelet aggregate to form the clot, clear, to seal the cut. This is also positive feedback. So I gave you two examples of positive feedback, that the function or the size is getting bigger, right? So those are positive. Now this is normal and this is helpful. When you get a cut, clot formation is helpful, right? Now you see, if by positive feedback clot is formed without a cut, like you didn't get any cut, a clot is formed inside the blood vessel. That is dangerous, right? That could be dangerous. You know that inside the artery of your heart, if a clot is formed, that can cause heart attack, right? Myocardial infarction. So positive feedback could be good, but also could be bad, right? So good is when we get a cut to stop the bleeding, but bad is if without cut, if the clot is formed by positive feedback, that can block the arteries in the body. Is it clear? During pregnancy, we want the uterine contraction at the end of the pregnancy, right? But if during second month or third month of pregnancy, if uterus starts to contract and increase the contraction, right, then what will happen? Miscarriage, right? Abortion. So that could be, harmful. So homeostasis tries to maintain the body environment constant, but positive feedback could be sometimes harmful. So those are two mechanisms, and I have mentioned that if the homeostasis or the control is lost, then it leads to diseases. Most common causes of death in the United States, in our country, top most is the heart disease. You see that 654,000 people die. This is an old statistics though, but still heart disease is number one cause of death. Why is this? What do you think? Why heart disease is, if you go to Africa, you'll see this number is way less.
Diet?
Diet, yes. Lifestyle, right? That includes your food habit. So that is a big problem in developed countries, right? In less or least developed countries, they don't get so rich food. They starve, some of them. So the heart disease is less than here. Okay? Cancer is second leading cause of death. Cancer is also very high among the white population. So what do you think? Why? This, how would you link this? I said particular. Second.
Skin cancer?
Skin cancer is very high, right? We know that. But as a whole, the rate of cancer is very high. That is genetic. Okay? Skin cancer has different reason that UV radiation, the skin is less protected because of lack of melanin. That's different. But as a whole, the incidence of cancer is very high because that is genetic. You know, how the DNA is built up in the cells. Okay, so this one, heart disease is more related to lifestyle, right? Cancer, why it is high? That is main reason is genetic built up. Stroke is number 3, and stroke also occurs due to 2 things mainly. One is there are 2 types of stroke. This is the blood vessel. If this is the brain, okay, and this is the blood vessel inside the brain. If the any clot is formed here, then the part of the brain will not get the blood supply, because we know that blood vessels carry the blood and that carries the oxygen and nutrition. So if this blood vessel is taking blood to this area, if any clot is formed, right, then the area will die. Make sense? The tissue will die. So that is one type of stroke. And another is, if this blood vessel, due to high blood pressure here, is ruptured, then bleeding will occur, blood will come out. Make sense? So that is also stroke. We'll talk about that.
Isn't that an aneurysm? When
Aneurysm, yeah. Sometimes what happens, you know, the blood vessel dilates certain part, like it's like balloon. This is the blood vessel. Okay. Then this will eventually rupture. Okay. So we'll talk about that when we talk about cardiovascular system. Just know that that is stroke. That is also a leading cause of death. Okay. So just know at least top 5. Accident. This is another thing, right? There's so many cars on the highways, right? And that is another big number of cause of death. What causes disease? Disease occurs in many ways. One is microorganisms. You know that microorganisms are everywhere, but those are microorganisms, right? So small that you don't see, right? You need microscope around you. If I, check your hand, fingers under microscope, powerful microscope, you will see how many microorganisms are there. Okay, so microorganisms are everywhere. They are so tiny that we don't see without microscope, but they can easily invade into the body. Make sense? So that is one common cause of diseases. Many diseases occur due to invasion of microorganisms into the body. Also inside your body you have microorganisms. We'll talk about that. So now tell me, which ways microorganisms can easily invade into your body? Food, right? So food. Another, so through your digestive system, right? Another is you are inhaling air 24 hours, right? So microorganisms can easily enter into your respiratory tract, right? So that is another potential,
Any cuts or
Yes, open wounds. Yeah, if you get a cut or you have abscess or any open area where the skin got tear, microorganisms can, because your skin is protecting, right, the body. So if that is another way. So microorganisms cause infection. Allergy. Certain things can cause allergy to certain people. That means what? That means some people are allergic to particular food or particular things, and other people could be allergic to different things. Okay? For example, asthma, you will see that some patients, they get asthma attack when they, winter comes, cold, right? In normal, summertime, fine, but when, in winter, cold causes asthma. Mold, right? Some people's body is so sensitive to mold. Some, pollen. Not everybody gets allergy, by pollen, but some people get, right? You will see that. Food, certain food can cause allergic reactions, allergy in the body, okay? But not everybody gets allergy from the same food, okay? So different people's body react differently to different allergens. Autoimmunity. Auto means self, immunity. Your body has immunity, right? That means what? Your body tries to protect itself from harm. Now, when an antigen, for example, a microorganism has entered into your body, bacteria, which is antigen enters into the body, your body reacts by producing antibody. So this is common response of your body, okay? When an antigen enters into your body responds, right, to destroy it by producing antibody. Make sense? So this is normal response of your body. Now, sometimes what happens, without any external invasion of antigen, your body responds against your own body cells without any antigen from outside. Your body starts to think your own body cells as antigen. Make sense? And start to fight against those cells. That's why we say autoimmunity. Your own body is fighting against your own body cells, right? And trying to destroy them. That is a problem, right? And if, for example, your body starts to fight against the cells in the joints, that causes rheumatoid arthritis. Have you heard that? Painful condition in the joints, right? So the tissue in the joint get inflammation because of that reaction, antigen antibody. I'm just giving you an example. What is autoimmunity? Okay. What is the allergy? Infection. We have talked about that microorganisms cause infection. Neoplasm is the cancer. So that is another factor that causes disease. What is cancer? Just in simple way, know that cancer is uncontrolled abnormal multiplication of the cells. Now you all know that body cells divide how? By, what's the name of that cell division?
Mitosis.
Mitosis. Very good. Make sense? I believe all of you have studied mitosis.
So 46 for chromosomes?
Chromosomes, yes.
So there's 23.
23 pairs, right? Yeah. So number is 46, 23 pairs. So this is normal, right? body, how the body grows from 1 to 2, 2 to 4, right? That's the normal multiplication, mitosis. And the chromosome number will remain same. Now, if the cells start to divide in a different way, uncontrolled way, like one cell divides into 3 and then further. So this is not the normal cell division, abnormal, uncontrolled cell division, and that causes tumor or cancer. Okay, so we'll talk about this more in future, but just know that cancer is due to uncontrolled multiplication of the cells. Heredity is another factor that some DNA might have the gene that is responsible for particular disease. Make sense? So, you will see sickle cell anemia is a clinical condition. It's one type of dangerous type of anemia that happens more in African black people. Okay? Because in their gene, they have that, abnormal gene in their DNA. Malnutrition. Malnutrition causes malfunction of the organs of the body. To run the normal function of the organs of the body, you need what? You need nutrients, right? Nutrients give ATP, energy, right? So, if the nutrients are not enough, your tissue doesn't get enough nutrition, then it becomes weak and it starts to behave abnormal. So that can cause problem. For example, anemia. One type of anemia is called pernicious anemia. Another is iron deficiency anemia. Probably you have heard that. Iron deficiency, probably you have heard, some of you. So, if someone eats the food that has less or no iron, then that person's red blood cells will not get enough hemoglobin. Now, why? Iron is essential for hemoglobin synthesis. Is it clear? To produce hemoglobin, you need what? Iron. So if someone has less iron, getting less iron in food, then the person will suffer from iron deficiency anemia. If someone gets less vitamin B12, then the person will suffer from pernicious anemia. Make sense? So nutrients are important. So those are, another is stress, anxiety, mental status, that is also another factor that causes diseases. Okay, manifestations of diseases includes signs, symptoms, and syndrome. Okay, so signs and symptoms, we commonly use that term, signs and symptoms, although they overlap, but there is a distinction between the sign and the symptom. Signs are objective evidence of disease observed on physical examination. For example, if the heart rate is abnormal, if I take your heart rate, heart pulse or heart rate should be in rhythmic way. Okay? Not like, first few are very fast, then get slow, then again fast. That is abnormal. Okay? Although I said that it should be 60 to 80, but even if someone's heart rate is 60 to 80, between 60 to 80, you cannot say that that is normal, because you must also look at the rhythmicity. If it happens in regular interval or sometimes fast, sometimes slow. If that happens, that is not right. Okay? So those are the signs we see. We check respiratory rate, heart rate or pulse, fever, sweating. So those are the signs. Symptoms are subjective indications. So signs are objective and symptoms are subjective indication of disease that is reported by patient. So two different things here. This is by physical examination and this is by the patient. What patient is reporting to you. Patient might not know that heart rate is abnormal. Make sense? He's feeling dizzy or not feeling good, but he may not report to you that his heart rate is abnormal because he doesn't know that. But when the clinician, doctor will examine, he will find those, right? If the respiratory rate is normal, heart rate is normal, blood pressure is normal. So what the patient often report, that I am not feeling good, I am feeling tired, I am feeling dizzy, right? Those are the things. Then by examination, doctors find the signs. Diagnosis is the identification of disease. So diagnosis is the identification of the disease. What disease is that? But to diagnose, you need to know or study the signs and symptoms. So first thing, when a patient comes to you, you do the test, right? Physical examination. Also you do the lab test, right? So physical examination includes, as I have mentioned, you check the heart rate, you check the body temperature, right? If that person has fever, you see the blood pressure, right? Respiratory rate. So those are physical examinations to see the signs, study the signs and symptoms to identify the disease. That is the diagnosis. Now you know that many diseases have some common signs and symptoms. You know that, right? Many diseases have common signs and symptoms. Like, any kind of infection can cause fever. Make sense? If infection occurs, it could be in your lung or could be in your, meninges. In meningitis or bronchitis, you might have, or pneumonia, you might have fever, right? Or chest pain can happen in any diseases of the lung. Make sense? So there are some common signs and symptoms, and there are some specific signs and symptoms. Those are particularly for that disease. Make sense? So you have to study both to diagnose. So remember that. Now, we see a number of things to diagnose a disease. As I have mentioned, anatomy and physiology you have to study. Why? Anatomy, like this is a condition, this is the liver, liver is here, located here, right? A large organ, and the tissue of the liver, in normal liver, these are the hepatocytes, the cells in the liver, okay? I'm just giving you an example. So this is the tissue of normal liver, this is normal. Now there is a clinical condition that is called fatty liver. In fatty liver, the liver gets a lot of fat inside it. Now if you make a slide of tissue and see under the microscope, In this case, you will see the cells, but in between the cells, you will see a lot of fat, accumulation of fat tissue. Makes sense, right? So if you examine this tissue under the microscope and this tissue under the microscope, by looking at the difference, right, you can say that this person has fatty liver. This simple example. Yes?
Isn't the fat tissue cellular too?
Inside the cell.
Well, the fat, it's fat cells, right?
Fat cells,
So
yes.
you'd see fat cells among the liver cells.
Yeah, adipose tissue cells, yes. And so you will see the adipose tissue or fat cells, many fat cells there, right? So in between the hepatocytes.
Yeah. I get it would have been just like difficult to differentiate.
Yeah, just I wanted to say more
Yeah.
fat, but of course, yeah, fat itself is one type of tissue. Yes, good. So you can examine, and this is anatomy, right? You are looking the structure, change of the structure. Okay. So you can study the cell. Another is if you have tumor here in this part of the liver. Okay. What can you do? You can take the tissue out and check under the microscope, histology, and you will see the cells. Many of those cells will have you will see the chromosomes, abnormal chromosomes. That's they are trying to divide two, instead of two, they are trying to divide three. So you will be able to see that. Okay. Normal cell division is not present there. Abnormal cell division is taking place in this part. So you can tell by studying the tissue that this is, that's what we do in biopsy. We see the tissue, tumor tissue or cancer tissue under the microscope. So study of the cell, study of the tissue, and study of the organ. So if the liver is large, you can think that size is much bigger than normal. So this organ might have problem. So we see different things, anatomical things. Okay. Changes of the physiology. We can also study the function of the cell. We can study the function of the tissue. We can study the function of the organ. So we examine both the anatomy and the physiology to see the changes to diagnose the disease. Here, what I showed, basically the same thing. You see the study of the cell. These are normal cells, and if you take the tissue from a tumor, you will see the cells are not normal. The shape is different. The size of the nucleus is bigger. Boundary, you see it's not unique. And sometimes you will see the multiple nuclei inside. So a lot of things you can see different, and you can tell that this is a cancerous tissue. Nowadays, you know that we can study the function of the organ or tissue by different techniques. PET, positron emission tomography, or CT scan. You can see MRI. You can see which area is working more, which area is working less. So those techniques allow us to see the amount of function inside the organ. For example, this is the brain. So you see those areas are shown red. The activity is more in those areas. Okay, so the color is indicating the activity area. Okay, so now this is amazing that you can see the activity inside the organ. So if I do MRI and I see that the activity is in this area is different than the rest part of the liver, then I will think something is going on here. Make sense? So that why the activity or metabolism is more there. Okay, so you can see that by those techniques that where the activity is more, where the activity is less. If you see in some area the activity is not present, like no activity here. When you do MRI or scan, if you don't see any activity here, that means the tissue is dead. Make sense? Tissue is not functioning. If you see more activity here, that means that could be a tumor, the area, initial stage of tumor where the active cell division is being taken place. Make sense? So why more active? That could be abnormal, indication of abnormal thing. Okay? No activity, that is also abnormal. Okay? So when more cell division occurs in tumor, the metabolism is more because to divide the cell you need the metabolism. Okay. Other ways, we do the biopsy, of course, take the tissue out and do histology, physical examination. Medical history is another thing that you ask the patient, not only the patient, the parents of the patient, if they had any, you all know that, the doctors will ask, did your father or mother, right, have any chronic disease or history of hypertension or blood pressure or diabetes or cancer, they will take that history. That is important. Okay, and medication history. So some medications can cause, in the long run, can cause problems. Okay, so I have already mentioned that we do the tests in many different ways. Physical examinations and also other tests. Prognosis. What is prognosis? Prognosis is the predicted course and outcome of the disease. So, doctors, when they talk to each other about a patient, they talk about prognosis. What could be the outcome, right? From now, after 1 month, or if it is a chronic disease, or 2 months or 1 year after, in which direction it can go. Make sense? That is the prognosis of disease. Now, the diseases could be acute or chronic. In acute, the onset is quick, duration is short. In those cases, we say acute disease. If it develops slowly and stays for a long time or throughout the life, that would be considered as a chronic disease. Okay? For example, infection. Microorganisms, they can invade into your body and cause problem, but when the microorganisms they're done, the condition you recover. So it happens like bronchitis, or it's not chronic bronchitis like due to infection, but chronic bronchitis is chronic. So influenza or measles, those are acute. Chronic includes the diseases, they last for a long time, many years, or even rest of the life. Arthritis, hypertension, chronic bronchitis, right? So bronchitis could be acute as well as chronic. Terminal is the disease that will lead to death, that will cause death. So when we use the term terminal, that means that person will eventually not survive, will die. Okay. Stages of disease: remission, exacerbation, and relapse. So remission is the signs and symptoms subside. So we say remission to indicate that signs and symptoms are now gone. After taking the medicine, signs and symptoms are gone. Remission. Exacerbation is the recur in all severity. So if it comes back after you take the medicine, remission occurred. It was gone, but it comes back again and with more severity. Relapse. If it comes back after a long time, like weeks or months later, the patient will think that I got completely recovered, but no, it might come back. So those are the terms we use in diseases. Outcome of disease. We say complications to indicate the diseases from diseases. Sometimes one disease, if you do not treat that disease on time, that eventually leads to another disease. Make sense? So if you don't treat that patient on time, that may lead to another disease. For example, diabetes. We know that diabetes is a chronic disease and you need to control it, right? You need to control diabetes. But if you do not control diabetes, that we all know that eventually can cause heart disease, disease of the eye, right? Brain problems, disease in the brain, and kidneys. So those are the common organs we say could be affected by chronic diabetes if the patient is not controlling the sugar. Okay, so the heart could be attacked, or brain, or kidneys, or eye. So those are the complications of diabetes. Sequela is aftermath of disease. Some diseases they are cured, but after they're cured, they leave some complications in the body. For example, polio. Polio can lead to paralysis. So, polio, if it happens in early stage of life, but that may cause paralysis, and even when the polio is gone, the paralysis stays there in the rest of the life. So that is the sequela. Mortality and morbidity. Yes.
Real quick. So say you get shingles after you had chickenpox as a kid. Would that be an example of sequela?
Shingles, we will say that it comes back. Shingles occur due to like if someone got herpes in early stage of life. Okay, then what can happen? Those microorganisms can stay in your body for several years. Okay, and no signs, no symptoms, but chicken pox. Okay, so chicken pox virus that can stay in your body for many years. Like you got 20 years ago, you got chicken pox, that can stay inside the body. And
so is it like a recurrence of the same disease technically?
Recurrence of same disease technically, yes, because the same microorganism.
So even though it's years later, it's the same.
Right. So it is not like because of that disease immediately after you got the problem like paralysis. It's different. Okay. So yes. So if someone has chicken pox, that virus, you may think apparently everything is gone, but not. Okay. And can come back after 30 years or 50 years even,
That'd be like a relapse.
Yes, relapse. And that usually we see that after age 50. Why? Because after that immune system starts to go down, right? So it is expressed. It gets expressed again. Okay. So mortality is the rate of or measure of death by disease. Certain disease, we say mortality rate is this for this disease. Morbidity is the measure of disability. Okay. So we commonly use those terminology. Okay. We have already talked about the risk factors. Okay, environmental. You don't want to live in an environment where the environment is not, healthy. We want to live in a clean environment, right? Where the microorganisms don't get chance to grow or multiply, right? But if you live in an area where the environment is not clean, you will get easily sick, right? So that is one thing. Then chemical, certain chemical can cause certain diseases. For example, if you live in an area where there are many industries, the chemicals are being released in the environment, that can cause asthma. Some people can get asthma due to the chemicals in the air. Okay. Physiological chemicals also include what you are eating. Food is a chemical. Okay, food is considered as chemical. So what kind of food you are eating, that is also important. What medicine you are taking every day, right? If someone is taking certain medicine every day, taking that chemical, you know that each medicine has good as well as adverse effect, right? So certain adverse effect is there. Physiological, how you maintain your health, right? If you do exercise every day, that is important, right? Maintain your physiology, normal function of the body. So if you don't do that, then eventually that can cause or lead problem, disease. Psychological health is important, you know that. Mental health, we always talk about that. And genetic factor, we have no control, right? So treatment of disease, we will be done in a few minutes. Treatment of disease. So if you go to a doctor, the doctor will do all kinds of examinations and will see the first thing he will do the diagnosis, then will give the treatment. But to treat a patient, you have to see that the nature of the disease, the characteristics of the patient, the goal of the patient and the physicians. So all those things must be considered by the physician. So the stage of disease, is it in early stage? If it is cancer, for example, if it is in early stage, right, or in the late stage. If it is in late stage, right, immediate aggressive treatment, right, because it's already late. So the doctor must be very aggressive, right? If it is in early stage, you have some time, so you have to think differently. So how the doctor will plan depends on a number of factors, and what the patient wants, that is also important, the capability of the patient. Now, treatment and prevention, those two things. Prevention, sometimes we say prevention is better than treatment. Okay, so prevention is the precaution. You stop the incidence before it happens, right? You try to stop the incidence before it happens. Like vaccination, vaccine, right? We take the vaccine to prevent certain diseases, right? So that is better because before you get attacked, you stop that. Even before your body gets, attacked like that. But once your body gets attacked, then you have to do the treatment. Last thing today, inspection, different ways we do the examinations, inspection, auscultation, palpation, percussion. Inspection is usually visual inspection. When the patient arrives, right, comes to you, you check the color of the eye, right? If that person has jaundice or anemia, right? Inspection. So visual inspection or other ways we can also do inspection. Auscultation is listening, the sound. So auscultation means listening. So often we use stethoscope to see if any abnormal sound you hear in the lung or in the heart. Palpation. Palpation is by pressure. You check the organ. For example, if someone has cirrhosis of the liver, okay, we know liver is here, so we can press here and see if the liver is soft or hard. In cirrhosis, the liver gets fibrous, very hard, right? So by pressing, you can tell that someone has normal healthy liver or cirrhotic liver. Make sense? So palpation. Also, by pressure, we take the heart rate or pulse. Percussion. Percussion is by tapping, hitting. Have you ever seen the doctor, like if you go to the doctor, will do like this? Old time they used to do a lot like this, okay? So to see the density of the tissue, what kind of sound it makes when you tap, okay? If a lot of fluid is inside your lung, okay? You have a lot of fluid here inside the lung. If you tap like this, it will be different sound, okay? If it is normal air, it will sound different. Makes sense, right? So those are the examinations done. So one thing before you leave, you need your attendance, your body. Just write your name and pass it to the next person.